All right. Hey, everybody. Thank you for joining us on this Valentine's Day. Hope you guys are faring well in the snow if you got some of it. I know we got dumped on over here in Olympia. So thank you for joining us. This is the first presentation in the 2019 Healthier Washington Quarterly Webinar Series. And today we're going to be talking about the future of Healthier Washington. So before we get started, let's make sure that we're connected. We have all attendees muted, which means that you can hear us, but we can't hear you. There'll be a Q&A session at the end of the presentation, but please feel free throughout the presentation to send us your questions. And you can ask those questions by typing them out using the panel on the right side of your screen. We're recording this webinar, and in a couple of weeks, we'll send you a link to the webinar recording and provide the slides from today's presentation. All right, so I'm pleased to introduce our panel of speakers today. First up will be Sue Birch, the Director of Washington State Healthcare Authority, or HCA. Next up will be Maria Corrigan, Special Assistant for Systems Transformation at the Washington State Department of Health. After Maria is Bonnie Winterstrom, and she's the SIM Project Director and Healthier Washington Connector for HCA. And I'm Rochelle Lalonji. I'm your moderator for today's webinar and the Health Transformation Communications Manager for HCA. All right, so the agenda for today. We're going to be talking about the future of Healthier Washington. We're going to cover what Healthier Washington is, what evaluation results tell us about the work that we've been up to and what we've been doing so far. And we'll be talking about the continuation of Healthier Washington, including what the future holds. We'll also have that time at the end for questions. And again, please feel free to send those questions in throughout the presentation. We'll be providing a really high-level overview of our Healthier Washington work, so we're going to be covering a lot of stuff today. If there's something that we didn't cover that you want to discuss, please reach out to us to help keep that conversation going. All right, so throughout this presentation, you'll hear some terms, including some acronyms and alphabet soup that you may or may not be familiar with. SIM stands for State Innovation Model. It's often referred to as the SIM grant. You'll hear more about this in just a bit. Healthier Washington, or you may see it as HW, this is a vision for how we transform health and wellness. Healthier Washington is a movement or a philosophy. ACH stands for Accountable Communities of Health. The term ACH stands for Accountable Communities of Health. We have 9 ACHs across the state, and each play a vital role in helping transform our health and wellness system. They help connect members of their communities with the care they need. PEB, or PEBB, stands for Public Employees Benefits Board. This program purchases and coordinates insurance benefits for more than 300,000 eligible public employees, higher ed employees, and retirees. SEB, or SEBB, is School Employees Benefits Board. Starting in January 2020, SEB will administer health insurance and other benefits to about 400,000 K-12 school districts, educational service districts, and charter school employees in Washington state. Coverage will be available for all eligible employees, including teachers, administrators, paraeducators, custodians, bus drivers, and many more. Behavioral health is a broader term that includes depression, anxiety, other mental health disorders, and substance use disorder, or SUD. And finally, we have Apple Health. In Washington state, Medicaid is called Apple Health. Now, Sue will talk with us about Healthier Washington.
Great. Thanks so much, Rochelle, and welcome to the 200 sites that have dialed in, and to all of you out there working with us in partnership. I do want to review a little bit. In 2015, Washington established a new partnership called Healthier Washington. And that partnership was based on a belief that the state needed a better healthcare system and a vision of how that system could be transformed. A $65 million grant from the federal government allowed the vision to become a movement. And that funding was through the State Innovations Models Grant, that SIM funding for short. So with this funding, Washington began to lay the foundation for systems transformation. It was a movement that put whole person care at its core, sparked the development of a new payment system that we frequently call value-based purchasing, And we embrace regional collaborations at all levels, encompassing many, many sectors. Many people refer to that as our Accountable Communities of Health initiative. The second phase of the movement came in 2017 with the Medicaid transformation. Now, some of you might be saying, wait, what was that? That was the old 1115 waiver that we used to talk about. But because it is now so foundational, we refer to it as the Medicaid transformation work. This was the result of the federal government waiver, which allowed Washington to transform the state's Medicaid system. And in this phase, Washington is designing innovations in long-term care for our aging population and has redefined housing and employment as part of our health and wellness system. The Medicaid transformation is built upon the strong foundation laid by Healthier Washington, supported by that initial SIM grant. Now, the SIM grant funding sparked huge advancements, making it possible to do things like establish the 9 regional accountable communities of health, design the unique program of long-term services to support an aging population, integrate housing and employment supports into the health system to supporting better patient and provider communications and outcomes, build a transformation support hub to help providers integrate physical and behavioral health and adopt the value-based payment, and create 4 value-based payment models. And these models support whole person care, access to quality health care in our rural areas, accountable benefits for public employees, including a new payment plan, UNP+, and the development of cutting-edge data tools to measure the effectiveness. Because of the SIM grant and the Medicaid transformation waiver, Healthier Washington is transforming the vision of healthcare throughout our state. It challenges us to go beyond simply treating illness to create a culture of health and wellness. Healthier Washington created a map pointing the way to a better quality of life for all Washingtonians, and it has announced to the country that Washington is a leader in health and wellness innovation. Washington is one of the few states that has statewide buy-in, coordinated efforts led by the Accountable Communities of Health in every region. And we're reshaping the outdated bureaucratic structures and forming new partnerships and new ways of working together. We're setting national standards for system-wide integration of physical and behavioral health care. We're pioneering new payment systems so providers can flourish in an integrated system. We're leading the nation in long-term services and supports for our aging population in a very home and community-based way. And we're breaking new ground with our foundational community supports programs, which are the housing and employment services, because we agreed that people can't be healthy, productive community members without permanent homes and stable incomes. There is something wonderfully unique about our state, and our work is really being emulated across the country. Now I'm going to hand off to Bonnie, who's really been a mastermind in all of this. And Bonnie, take it away.
Thank you, Sue. Hi, everyone, and thanks for being with us today. I've been working with Healthier Washington since January of 2016, and I'm excited to share some high-level evaluation results. Our state-level evaluation of the SIM program was conducted by the University of Washington in partnership with the Center for Community Health and Evaluation, CCHE, and the Research and Data Analysis Division at the Department of Social and Health Services, RDA. Overall, the evidence signals that our work is having a positive impact and that there's a lot more work to do. So on to the findings. Our evaluators found that SIM grant funding increased Washington's readiness for system change in the next decade. Findings also showed that the creation of 9 regional accountable communities of health was a major achievement. ACHs have become critical organizational infrastructure for regional capacity building. They're the foundation for collaborative regional advancement of the Healthier Washington movement. Based on overall qualitative analyses, partners believe that transformation could take decades. So to sum it up, SIM created an important foundation. It laid the groundwork for a movement that is very much in motion with a lot left to do. RDA did specific quantitative analysis on integrated managed care looking at outcomes from our early adopter region in Southwest Washington. If you aren't familiar, integrated managed care is an initiative where both physical and behavioral health care is delivered to Apple Health clients through one integrated system. Our whole state is moving region by region to this system by 2020. The evidence shows that this model is working and that Apple Health clients with either a serious mental illness or both a mental illness and substance use diagnosis are receiving better care and experiencing better outcomes. So what do we mean by this? Specifically, evidence shows that this model gives clients easier access to services. That means it was easier for them to get into primary care, get screened for health conditions, and it was easier for them to get into mental health treatment. We also saw that care for clients with multiple issues was better coordinated, making it easier to live with more than one health issue. And we saw that clients in this region used the emergency department less. Based on these results, we're excited to continue implementing integrated managed care across the state in partnership with counties, providers, managed care organizations, and lots of others. SIM had many other projects and initiatives that were included in the evaluation. Here are just a few more high-level findings. We've been able to increase healthcare quality. Several of our models, including our UMP Plus plan for PED members, as well as our rural payment model for federally qualified health centers, showed that there were some improvements in the quality of care people received. So this is just a very small snapshot of our evaluation results, showing us that our early efforts are good. We'll be releasing the full evaluation reports at the beginning of March and hope that you will all take a look at them. I also want to send a huge thank you to our evaluation partners who put in countless hours to produce this evidence. And now I'm going to turn it over to Maria Corrigan, one of our close partners at the Department of Health, to talk about DOH-specific work and outcomes.
Thanks, Bonnie. So the Department of Health was responsible for several deliverables through the SIM grant. These included standing up the Practice Transformation Support Hub, which I'm going to refer to as the Hub, creating the Plan for Improving Population Health, and producing population data for Healthier Washington data dashboards. I'm not going to be talking about official evaluation results, but reporting more on reaching process milestones. Through the activity of the Hub, our focus was on providing support to providers to deliver integrated care, enhance clinical community linkages, and move to value-based payment with a focus on small and medium-sized providers and behavioral health providers. We provided this support through in-clinic coaching, webinars, meetings, and a resource portal. Much of the focus was on integration of physical and behavioral health. We learned many lessons about support needed for financial integration, and we also learned that financial integration is a different body of work than clinical integration, that one didn't necessarily lead to the other, and that both are necessary. Different providers have different needs, and there are still systems that need to be built and incentives that need to be properly aligned to support and drive integration. We also learned that, as Bonnie mentioned, transformation takes time. Over time, our ACHs grew to appreciate the need for providers to receive this support in transformation. The work of this support has been transitioned to them, and DOH is now playing a slightly different role. So next slide. One component of developing the Hub was developing, in collaboration with the University of Washington, the Practice Transformation Support Hub resource portal. The portal was originally built for the purpose of supporting providers with curated resources to help them with transformation. At the same time, we were working on developing the Plan for Improving Population Health, now called the Population Health Planning Guide. Instead of having this be a document that sits on a shelf, we made the guide an interactive tool that we can easily add to and update. We placed it on the portal thinking that it would be useful to expose people working on population health to the transformation work of clinical practices and vice versa. From there, our thinking grew on what the portal could be, not just a place for going for resources, but a virtual space where the clinic and community could work together with a broader goal of creating a community wellness system. We've slowly been building the site to include ways for teams to work together. For instance, community health workers are planning to work together on the portal. The portal also has resources from public health programs and provides access to local services. With this expansion, we are rebranding the portal, and it is now called, as of today, the Healthier Washington Collaboration Portal. So I really encourage you to check out this newly branded resource at waportal.org. The work of linking clinic to community and community care coordination systems is really important to the Department of Health. We understand that it is fragmented systems that lead to gaps and inequities. The portal is just one component of this work that we're excited to continue as we provide leadership and exercise our public health role as premier. Next slide, please. Using SIM dollars, we were also able to support 3 local health jurisdictions in developing and defining the role of public health at the accountable communities of health. Through SIM and through the Medicaid transformation projects, we've been able to do more thinking and strategizing about how DOH resources might be used to enhance and complement the work in the ACHs. The department sends significant resources into communities through local health jurisdictions and community-based organizations. And even when these dollars come to us with some restrictions or specific purposes, we always have opportunities to think about how they can have the most reach in communities. Because of the SIM work and relationships built across agencies as a result of this work, DOH has taken a different approach to creating the State Health Improvement Plan, which is a requirement of us achieving accreditation as a health department, but we recognize can be much more. The table that we've set for this work is much broader than public health, and we're looking for those state-level, system-level alignments that will allow us to make more progress as a state in achieving health equity and improving health. So now I'm going to hand it back over to Bonnie.
Thanks, Maria. So over the last several months, we've been working to see whether there's value in continuing Healthier Washington beyond SIM and Medicaid transformation. Our communications team, in partnership with state agencies, accountable communities of health, the governor's office, and others, have been doing research and holding conversations. Overwhelmingly, we heard that Healthier Washington is bigger than SIM, and that there's value in continuing Healthier Washington as a way to talk about health transformation. Healthier Washington gives us a banner to use when collaborating on shared goals, and it unites us around a culture of health and a vision of healthy communities. Healthier Washington was started as a way to talk about the SIM grant and evolved as a way to talk about Medicaid transformation. Through these conversations, we've decided it will continue into the future. It's a way to embody all of the state's efforts to transform the health and wellness system in Washington in a collaborative and innovative way. I'm also happy to announce that the vast majority of the work started under SIM is not going away. It will continue. We've worked hard on sustainability planning, and it's great to see it become a reality. A few examples of the programs we're continuing that started under SIM are integrated managed care, which means physical and behavioral health care will be integrated for Apple Health clients. The Accountable Care Program, also called UMP Plus, will continue to be a benefit option for public employees, retirees, and their families. We're also working on a similar option for sub-members. Workforce transformation, which is focused on making sure we have the right kinds of health workers in the right places and that we're supporting them in the right ways. Rural health transformation, which addresses issues and supports initiatives that are uniquely rural. Shared decision making, which helps people and their families make healthcare decisions that are in line with their values. And community transformation through accountable communities of health, which is a huge body of work that our Medicaid transformation is sharply focused on. On the topic of continuing work, our largest body of work under Healthier Washington right now is Medicaid transformation. We have 3 more years of this work. It will improve healthcare delivery and outcomes for Apple Health clients. The transformation has 4 main initiatives. Initiative 1 is transformation through accountable communities of health, as well as implementing projects specific to Washington's tribes. This initiative empowers ACHs to implement care transformation projects in their regions, to link clinical to community, integrate care, and pay for value over volume. The ACHs are working hard on implementing their many projects. These projects focus on care coordination, chronic disease, maternal and child health, and other important topics. To hear more about Medicaid transformation tribal projects, please tune into the next quarterly webinar where we will go into more detail about these projects specifically. Initiative 2 is led by our partners at the Aging and Long-Term Support Administration at DSHS. This initiative supports unpaid caregivers and helps older adults stay at home longer and avoid more intensive services. Initiative 3, also called Foundational Community Supports, is focused on helping our most vulnerable Apple Health clients find jobs and housing. To date, this program has enrolled over 3,000 people. Our newest initiative focuses on improving access to substance use disorder treatment. As you can see in here, Medicaid transformation is a huge body of work. This is one of our top priorities under Healthier Washington and will continue to be for the next 3 years. We're very committed to this, working closely with partners to implement these initiatives and respond to critical needs and issues. We're already working on how to sustain the work beyond the end date of 2021. And now I'd like to hand it back to Sue to talk about the future of Healthier Washington.
Thanks so much, Bonnie. It is really amazing what's been accomplished. And being new to all this, because I'm just here now a year, it's clear that while Healthier Washington was written some time ago, that the successes and the work is really just getting started and really starting to come in. It's changed the way we think and work. It's shown us the essential value of collaboration. It's established a foundation of public engagement that is both broad and deep. And it's garnered the attention of health system experts throughout the country. As the SIM grant ends, we're pursuing new grant opportunities and private and foundation funding partnerships. And we still have big questions to answer. Questions about data, rural health, health equity, and we're striving every day to find the best ways forward. Healthier Washington started with a belief that change was needed. It became a vision of what change would look like. And today it's a movement, leaving behind the notion of simply treating illness and leading our state towards building a culture of health and wellness. I can't thank you all enough for being on this journey with us and for plowing forward. I think at this point I'm going to hand this back off to Rochelle, and we're going to start taking some questions from all of you.
Yes, absolutely. Thank you so much, Sue, and thank you to all of our other panelists. Great job. All right, so we're starting to get some questions filtered in, and the question that was asked earlier on is about our ACHs. And the question was, will ACHs go away? So Bonnie, Sue, do you guys want to talk about that?
Sure, I will start. So again, the question is, will ACHs go away? And we know that ACHs are really built into our Medicaid transformation work for the next 3 years. So I'm assuming that means after that period is done. And I'll say we see a really important role for ACHs after Medicaid transformation. And in partnerships with the ACHs, we have a lot of work to do to shape this role. Since we're not dealing with a financial cliff, we're committed to figuring out with ACHs and all of you in an open and transparent way, really what that role looks like after Medicaid transformation. And Sue, did you have anything to add?
Yeah, Bonnie, thank you for that. I think it's really important as we are out and meeting with county commissioners and meeting with legislators that we continue to say we have invested and built up our work with the ACHs in the hopes that we are building them to last. We don't have the exact answers yet for how they will be sustained because there are all sorts of moving parts going on with our federal partners. But we are committed to their ongoing development, especially since we have an evaluation that identified them as being so successful. And we feel confident that in the coming years, we'll be figuring out a sustainability path in partnership with our locals.
All right. Okay, so question that we got, it was kind of a multi-question within one question here. How are we improving the quality of care for marginalized people? How do practitioners communicate about a client? How do we prevent misdiagnosis? How do we minimize harm? And Sue is just eager to answer this one, so I'll pass it off to her.
Well, first, I just want to call out that the Affordable Care Act and our movement really gave us the opportunity to begin to really people towards getting into primary care and getting preventative care. And our partners at Department of Health and our partners at the Health Benefits Exchange have given us some great data about how we are reaching to more diverse populations, and that their prevention services, things like mammography and cancer screening rates, are going up. Now, we know we need to improve and keep getting more dissected data for equity and really trying to understand this movement further. But initially, we've been able to quantify and report out on the improvements in both primary care and with prevention services. So we're really pleased about that. We also know through Initiative 2 and 3, not just aging and disabled folks, but also with providing more housing and employment services, that we've reached towards more vulnerable folks as well. And so those are other ways where we know we are improving the quality of care for marginalized people. Those are just some very minimal examples, but we have a number of areas where we can quantify the improvements. Not to say we're done with our pursuit of equity work. We have a long way to go, and it is one of the key goals that our partners at Department of Health are layering in for all of us as we move forward. What a great question. Thank you so much.
All right, so we had a couple of questions come in on the value-based purchasing models. Bonnie, are you able to talk about that?
Yeah, so we got a couple of questions, as Rochelle said, saying, can you speak more to the 4 value-based payment models referenced earlier, and can you talk more about the 4 VBP models? So these 4 models, these questions are referring to are part of our SIM grant, and I'll talk about each one in turn. So Model 1, we also call Integrated Managed Care, and it's a model that I was referencing earlier regarding the evaluation results, where we have both physical and behavioral, and remember, behavioral health includes both mental health and substance use disorder treatment, into our managed care system for Apple Health clients. We have a statute in Washington from our legislature that says all of our Medicaid purchasing regions, which also mirror our ACH regions, are required to move to this model by 2020. So we have several regions that have already moved to this model, and then we have a couple others that will be going this year and then in January of 2020. Payment Model 2 is regarding our rural work. So there's a couple of different parts of Payment Model 2. One part is related to creating a better payment and delivery system for our federally qualified health centers, or FQHCs. So I won't go into the big details of that. A lot of that is on our website, and will also be described in the evaluation reports I was referring to earlier. And I should also mention that we will have a large final report for our Healthier Washington SIM work that will be coming out in May, which will have a lot more information about everything. So we'll make sure to send that out really widely when it's completed. But this model really changes payment for federally qualified health centers in a way that allows for some incentives for quality measures. So nobody gets any less than they would have otherwise, but there's some additional incentives for doing certain things and getting better outcomes for their clients. Another big part of Payment Model 2 has to do with rural health transformation with our hospitals, and that is something that we're currently in, that's in the works. And I'm not an expert on that, so I'm not going to speak too much to it. But we're working hard on that, and it's moving forward. Payment Model 3 is also called our Accountable Care Program, and that's the one I was referencing that is for public employees through the PED program, and we're also working on a similar benefit offering through our school employees program, which will go live in 2020. We also call that model UMP Plus, and we have 2 provider networks that we're working with to create a benefit offering, so a medical insurance offering that just provides better care and care coordination, has quality measures associated with it, and just provides, I'm sorry, I'm drawing a blank, but again, I'm not an expert on the details of these models, but very much a benefit offering that offers better care to PEB members and soon-to-be SEB members.
So Bonnie, I'd like to just jump in. This is Sue. Another question came in about our integrated care model and how we're going to measure outcomes. And I think it's really important to springboard off what Bonnie was just talking about. We know that measuring value includes not only measuring the cost of care, but really anchoring it in the measurement of quality care. And Washington is a leader in this country around quality alignment with our common measure set. And as Bonnie was talking to you about the payment modalities, all of these dovetail in with our quality alignment efforts. And so we will continue to measure outcomes. We are moving beyond just the traditional kind of medical measurement. We've been bringing in population health metrics. I talked a little bit about the prevention screening services that we're measuring. We're measuring other social determinant types of things, and all of these things will continue to play out. One big initiative here in Washington is with our partners at Upstream, and they're working on unintended pregnancies, teen pregnancies. And so that's an example that we will dive further into the social determinants related to having kind of better maternal and child health outcomes. But the common measure set, as well as our measurement of value-based services, really critically important. Getting our clients to understand how to be better utilizers or slow down on their utilization if it's inappropriate, and then the quality of those services, two of the foundational pillars of Washington's work. And I want to move on to another question because we've got a whole slew of them here. There's one about how does dental managed care play into all of this? Well, here's another great example. Acora Foundation, one of our big partners, just released a report. Washington is 4th best in the country for our kids that are our Apple Health kids that are getting dental care. We just fired off a series of questions about, well, what's that doing to our absenteeism rates at school? We know one of the big reasons that kids miss school is for dental pain. And so we're getting more sophisticated about crossing that data. And the dental managed care coming up for adults, we know that families that get dental care or parents that get dental care are more likely to really push those services through to their kids. So we believe that we'll see improved health outcomes with both dental on the adults and, again, improved returns and successes for our kids. So I think we'll move on to the next one. There was a question about, Sue, does improved access to care include specialty services? And I do want to acknowledge that, yeah, our state, like all other states in the U.S., have some pretty significant challenges around specialty services. This isn't unique to just our Medicaid population. It's hitting our commercial population. With the ACA, we opened up a floodgate of folks needing to get their health anchored. And we are very excited that this legislative session, there's a number of proposals about telehealth. And we are looking at some innovations to anchor improvements around access to specialty services. Several of our partners out at the federally qualified health centers have some very unique innovations going on, doing e-consults and whatnot, and we're looking to try to help get those to scale and to improve so that we can get better access to care, including for those specialty services.
All right, so another question that we received was more specific to the presentation, and it was, who were the 3 LHJs that were noted on one of your slides? Can you share more about the work that they did? And I'm trying to remember who.
That was me.
Okay,
yeah.
Thank you, Beth.
Sure. So the 3 LHJs were Clark County, Snohomish County, and Walla Walla. And they really were doing work on behalf of their own health department, but also on behalf of their ACH. So when we had local health jurisdictions submit letters of interest to participate, they really had to make a commitment to kind of involve all of the counties in their ACH, because we really wanted to have that comprehensive public health presence at the table. Most of the work was around data, which makes sense because public health, that's kind of a foundation of the type of work that we do. And so Clark and Snohomish counties really had a big focus on data pieces and providing data to the ACHs. Snohomish had a focus on diabetes, and in Clark County, in addition to data, I know that they did some work on connecting some of the opioid work there. Generally, also the public health folks at the ACH tables provide connections to like prevention interventions that we want to kind of infuse into the clinical setting. So there is that piece, and again, the connection to the opioid work, which is public health is very involved in. In Walla Walla, there was a lot of so that county is in a very geographically broad ACH region. So with the funding that they got, there was an effort to really provide some resource to some of those smaller counties out in that part of the state who would otherwise have a hard time engaging with the ACH because folks at those health departments are spread pretty thin. And so that work was really focused on how do we create the situation where more people can make it to the table, or if not that, how can we make sure that we are taking the time to connect them via calls and that kind of thing to keep them aware of what was happening with the ACHs. They also did some partnership mapping in Walla Walla, so figuring out who are all of the entities that are out in those counties that could potentially be connected to ACH work. So that was also a part of their work.
All right, thank you, Maria. We had a question in terms of IT infrastructure. So the question was, what type of IT infrastructure or tech platforms are being used, as much of this is heavily evidence-based? I'm going to pass that off to Sue.
Yeah, so three things come to mind that are either in play or are in further development. And the first is our efforts around the clinical data repository. And our team here has really done a yeoman's job at getting up the CDR. Another team I'd like to give a huge shout out is our ARM team. They are really working closely with RDA and doing quite a bit of the data kind of infrastructure. But there's a third emerging team that I host with all the other secretaries from the Health and Human Service agencies, including the newly formed Department of Children, Youth, and Families. And that group is called the ESC, or the Executive Steering Committee. We have quite a bit of significant visioning going on about how our IT systems need to be modernized and further integrated in our evolving, transforming systems of care. And so we're looking at some of the enhancements that need to occur to make us more efficient and to use data in a different way. And other key partners at the table are our health benefits exchange partners, because there's so much that goes on when people identify needing health insurance or changing health insurance that we want to mine and better understand so that we can draw our clients into this health journey further as we continue to evolve whole person and person-centered care. So those are three of the IT infrastructure or tech platforms that we're very excited about that are all in motion. There are some ongoing conversations, and we're monitoring this closely with some of our business partners who are also trying to align on some of our smart health systems and some of the other sorts of innovative new app modalities. Washington was just awarded University of Washington was awarded a very exciting new behavioral health app called Focus, and they'll be testing that with our community mental health and our federally qualified health center clinics, and we'll be in lockstep as that app evolves and is a supporting technology to manage our folks with persistent severe mental illness. So I wanted to just take a little bit of time, and I know this is not so easy for us to take questions back in, but one of the things that I would ask you all to think about and convene about, and I'd like you to discuss, I'd like to keep hearing client stories and how you all can feed our portals. There are so many times where the governor and the First Lady ask me about, Sue, what's the recent success? And as much as you can keep helping share that story, our communications team is wanting to host a national summit about communicating, about building a culture of health in the future. And so one of the things I would ask you is, are you doing all you can to codify and tell us the stories of success that we're creating at the client level so we can keep humanizing all of this transformation activity? The other thing, and I know this is going on with our ACH partners, but we'd like to keep hearing about what are the efforts that the locals are doing around sustainability and their creative thoughts. And also, what does success look like in 5 years for each of our ACHs? We love the unique distinctions of all 9 ACHs, but we need you to keep helping shape what success looks like in your region. We've had quite a few meetings with the Pierce County leadership and the Olympia leadership as well. And we want to keep having that dialogue so we can be certain that as we are all co-creating a future for Washington and building towards a healthier culture, that we are hearing from you what success looks like.
All right, thank you so much, Sue. That's some very thought-provoking questions for us. We just had a question that came in and is asking about data availability. So, do you have data available to show a reduction in ED visits and cost savings in early adopter regions? So I'm going to pass this off to Bonnie.
Thanks, Rochelle. So the RDA report, where we learned more about findings for our early adopter region in Southwest Washington, that will be publicly available in the beginning of March, and it's a great report. I would really encourage everyone to read it. And then ongoing evaluation of integrated managed care will continue through our independent external evaluator activities for Medicaid transformation. So we'll continue to see some outcomes and findings as we continue to look at those regions. I also did want to say really quickly, I didn't talk about Model 4 when I was talking about payment models earlier. Just wanted to say at a very high level that Model 4 is our data aggregation pilot, where we did a data aggregation pilot with an urban network and a rural provider network.
All right. We've got another question coming in, and we have Ryan scribing in here, so hang on just one sec while we get the question. Okay, so with the expiration of the SIM grant, is it time to reassess the number of programs that we have underway?
So I'll take that one. This is Sue. And I have to say, when I came here a year ago, I think I had a little bit of a hard time catching my breath when I looked at kind of the breadth of activities going on. But we began a process here called the Governor's Sub-Cabinet, where the Health and Human Services secretaries convene on a regular basis. And as I got deeper into the work aligned with the other leaders of the state, it became really clear that more hands spread the load, and that we didn't need to cut back on projects, but that we needed to keep a tight command center and a tight focus about healthier Washington really being our ongoing kind of vision and blueprint for the future. So no, we don't need to cut back on things. The things we have tried that have come to an end, we may not renew in the same sorts of ways under the SIM grant, but mostly the activities underway, we're very comfortable in propelling those forward and spreading that load with all of you. It's clear that we're in a paradigm shift, and I believe strongly that we need to keep the momentum going about changing things so that we can break out of some of our perverse, kind of old, sick systems that aren't serving the state and our nation very well.
All right, so we are almost at time here. We're a little bit before 12:50. We've had a few questions that have come in that we have not answered. We're going to be finding some responses for those and sending those off to you guys. So if we haven't answered them here, we will. We just want to make sure that we have the accurate information before we let you know. So So that's happening there. We do have a few more minutes if anyone has any other questions, or I'll put it back to our presenters here in the room and Maria on the phone. Is there anything else that you guys wanted to share about the future of Healthier Washington? Okay.
Well, this is Sue, and I would just want to thank all of you for all the efforts, especially the team here at the Healthcare Authority, especially with our partners at DOH and DSHS, Health Benefits Exchange, as well as the newly forming DCYF. We're all in this together. We couldn't be doing this without our key partners, the Accountable Communities Health, and many, many others. So we've got to keep pushing forward and building out this culture. And please don't be bashful about being in touch with us. We'll be continuing to get information out, and we will be continuing these quarterly webinars because we think it's a way just to kind of clarify things and to maintain some more information going out. Again, follow our newsletters. Please keep joining in on the webinars. We love the site visits. Keep inviting us out. We'd love to see things that are in action that are really shaping our state's reputation and the work that we're doing. Thank you all, and have a great day. Be safe and stay warm out there.
All right.